Hello, fellow classmates. My name is Alexis Acosta, and I'm here today to present my social issue topic of the U.S. inequality of coverage and access to health care services that are provided to the public. I will be primarily focusing on mental health services that are inequitable to those within the nation and how some insurances do not coverage to seek professional mental health resources or services. A story that I found while doing some research was that a previous senator named Pete Domansik had a daughter who was diagnosed with schizophrenia, and he was a huge advocate to promote mental health services so that all can have a fair opportunity to seek services without the financial barriers. From this, the policy was passed in 2008, and he did retire in 2009, which he felt that he completed something as a senator. So that was a fun story that I saw. Why should social workers care about this policy? Why should social workers care in general? Is that research has shown that 43% of Americans did not receive mental health services within the year of 2022. 43% is pretty high in numbers, and that means that people were just unable to seek mental health treatment due to financial barriers, or maybe they were unaware that their insurance can provide for mental health services. And the policy that I will be talking about today is the Mental Health Parity and Action Equality Act, also known as MEMFRA. It's kind of hard to pronounce, but it's pretty mouthy on that. So within the textbooks edition, it could be found in chapter 12 about how legislation came to an agreement that policy provides services for those with mental health needs within the same treatment as a medical health care services, meaning that no insurance can avoid an individual about mental health services. They cannot deny them access. Mental health and physical health should be treated very much the same, and there should be no discrimination on that. Changes that were done in the policy was that the policy did included copays and deductibles, and now people who couldn't afford mental health can now afford it now due to these less financial barriers, and it's more affordable within their budgets. And then it also reduced stigma within our nation, and it was an improvement that mental health should be treated and it should be a main priorities for the individual's well-being. I will say also why social workers should care and be concerned about the inequality of coverage and access to mental health care is that social workers usually encounter those individuals with direct practice of those who are less fortunate and who are not very much privileged. There is distress and an increase of social isolation if the individual cannot afford mental health services, and it leads them more towards a darker hole. But as social workers, we want to encourage our clients to seek these resources and provide the best beneficial outcome as possible. Usually people of color or people of color and populations within rural area usually face barriers and are limited to resources. So if we can help with mental health resources and providing that to our clients, it's going to be a much better and healthier outcome to those in need. Some recommendations I do recommend for the policy change would be to incorporate behavioral health workers and working alongside with us to reduce stigma and promote early detection of mental health symptoms. That is all for my presentation. Please feel free to leave comments or improvements on this, and I can't wait to hear what you guys think. Okay, bye.